every day. My jaw would be sore from a tick, but this, when I put this in, my jaw tick settled down. It's pretty much gone now. I haven't had a headache yet. I've maybe had one or two within the month, but that could have been anything. But I feel better. I notice when I take it off, my ticks do come back, but I see a major improvement every day. I used to not be able to talk to people without having a massive load of ticks, but now I am. I'm able to go to shops, Walmart, anything, and just browse. I used to not be able to do that before, but now I am able to.
This is Zachary. Zachary's a 22-year-old boy who first experienced Tourette's at 7 years of age. He came to my office a day or two ago, and we took an MRI on him. We took x-rays on him today, and we've prepared a splint for him, and we're going to deliver it today. Tell the audience what you've been going through the past 8 years or so with your Tourette's. Tell them all the tics you have. You have head tics, face tics,
facial, some verbal, like grunting, whole body jerks, shoulder. I mean, I probably tear a lot of muscles, pull muscles with my shoulder tics that I have. Always sore. I mean, I never complain about it, but I'm always sore 24/7. Hopefully they go away.
You sweat a lot?
Yeah. I mean, I drink maybe 3-4 gallons of water a day, and it comes right back out like it's nothing. So.
Okay. How do you do in school?
Not very good.
Grade-wise?
B to D. I mean, college, it was a lot better. It was A to C, so I don't know.
How do you do with the girls?
Alright. I mean, I got my girlfriend right over there.
What other than her? I mean, most girls get turned off by her.
Yeah, I'd say so.
Yeah, you got one that understands you, huh?
Yeah.
Okay, well that's good. That's better than most guys have.
Yeah.
Okay, and your mother found out about us on the internet, huh?
Yep.
Okay, good. Okay, just stare into the camera a lot, and you know, show the audience some of your tics. And this goes on all the waking hours, 24/7, right?
Even when I try to sleep. I mean, I was up till about 2 in the morning last night, and sweating really bad.
How long does it usually take you to get to sleep every day, every night?
I don't know. If I try going to bed early, I mean, I'll stay up late. I mean, my mom works third shift. I call her at 3-4 in the morning, and I gotta get up at 6:30 to go to work. So I mean, I might get 2.5 hours of sleep each night.
Oh.
And I mean, I can go a full 12-hour day at work without being tired. I mean, I'll get home, and then I'm just physically as sore as can be. I mean, I feel like as in a weightlifting competition or something, extremely sore. Can't stop sweating ever.
Most people take 15 minutes to get to sleep. You take much longer than that.
Yeah.
Because most of my Tourette's patients say they take 2 hours to fall asleep at least at night. That's a curse, in my opinion. You know, if you can't sleep soundly, that's one of the curses in life. Okay, let's see what we have here. Wait. Jump. Tap down. Does one side feel higher than the other when you tap down?
Mm-hmm.
Oh, which side feels higher?
Right.
Right side?
Yeah.
Okay. They feel that's that way, but see, it looks like you're hitting even heavier on the left side. You see how the marks are darker?
Yeah.
Right. That slows him right down, doesn't it?
It sure did. It's amazing.
Okay.
How's it feeling there?
Alright.
Does it hurt you in any way, shape, or form?
No. It's just a little uncomfortable. I'll get used to it.
Yeah, you have to get used to it, like with contact lenses. That's the best thing I can relate it to. For about 24 hours, 36 hours maybe, and then you won't even notice it in your mouth.
Alright.
And if he grinds his teeth a lot at night, you know, he may wear it down and symptoms may come back, and then you come here and I'll rebuild it back up again, and then symptoms may creep back and I'll rebuild it, and so on and so forth. That's how it works, but I won't have to do that as frequently. You know, that'll lengthen and lengthen and lengthen like that.
Okay.
I can talk better than I thought I would be able to with it in, but
Yeah, it's not going to be like the tongue blades you had. Yeah. See?
And I won't drool all over myself either.
Right, and no one's going to see it. See, there's a lot of advantages to this.
Yeah.
Yeah, you think this isn't going to slow down your kissing of this young lovely here with like the
Oh, it won't.
The tongue blades.
It won't.
Yeah, okay. You want to try kissing them now? Just kidding. Okay.
That's all right.
Not while the camera's going anyway. Okay. Each time you come, we will want to record you and just notice the improvement.
Okay.
Zach has seen a psychiatrist, a neurologist, 2 psychiatrists actually, and the one he at one point was taking 6 different medications. He weighs about 215 pounds now. At one point he weighed 320, and it was from the medications.
Wow.
And really it was no improvement. They just kept adding medications, hoping that it would help, but it never did. They tried Ritalin, all kinds of medications, all the antipsychotics that were real hard on him. He had some of the tardive dyskinesias even from the medications, where he'd have to take him into emergency room and have the reversal drugs given to him, and it's been a long 13 years. So, this is amazing that it can be drug free.
This patient returns after 4 weeks of receiving his appliance. He reports 2 very, very good weeks, 1 so-so week, and then the 4th week, which was very bad. His tics had returned because he had worn down his appliance due to constant grinding on the appliance. And open. Perhaps you can see and hear the indentations where it's all worn down. And what we're going to do is refresh this today and build it back up and reinsert it in his mouth and send him back on his way. And the rebuilding of the appliance is going to eliminate these tics and these uncontrollable movements. Okay. About 8 minutes have gone by since we took this out of the patient's mouth bite. We're putting it in, and I'm going to adjust it. Is one side higher than the other?
Yeah.
Okay, which side?
Left.
Left. Chop chop. Okay. You notice how the patient's symptoms have almost decreased completely, not quite, once we put the appliance back in. I'm just going to adjust it, fine tune it, open. You can see how he's hitting much harder on the left side than the right side, so I'm going to lower this left side here. Just tap up and down. Good. Right. That should feel pretty darn even. Right. Tap about 5 times. And that'll reset your nervous system. That's the entire adjustment, believe it or not. That's all that's needed. Does that feel better?
Yeah.
calms you right down?
Yeah.
You owe me $100,000. Okay. That's a total of about 11 minutes for this appointment. It doesn't get any better than this. That's all that needs to be done on these patients. Now, if he doesn't wear it down, he'll be symptom-free for a longer period of time. If he wears it down, we just rebuild it, and his symptom-free intervals will get longer and longer and longer and longer and longer as time passes. Okay?
Yep.
This young man presented with head jerks, twisting of the neck to the left and the right, bilateral wrist tremors, bilateral arm jerks, bilateral leg jerks, vocal tics, constantly saying, no, no, no. This boy's TMJ symptoms were bilateral frontal, temporal, and occipital headaches 2 to 3 times per week for the past 5 years. Bilateral mastoid pain for 5 years. Photophobia, bilateral retroorbital pain, vertigo and lightheadedness, loss of equilibrium, bilateral tinnitus, bilateral TMJ clicking upon opening of the mouth, bilateral TMJ clicking upon protrusion of the mandible, bilateral TMJ crepitus, bilateral suboccipital pain, bilateral neck pain, stiff necks in the morning, cervical crepitus, bilateral shoulder pain. This is this young man's panoramic x-ray. Notice the impaction of his wisdom teeth. It is always best to get these teeth taken out prior to the institution of treatment so that the discs are not dislocated after you started treatment or the case is made more difficult by this surgery. Get all surgery done prior to delivering the appliance. If the patient needs other types of surgery like gallbladder surgery, colon surgery, female type surgery, get all of that done prior to instituting the treatment and reevaluate the patient after they've had their general anesthetic for these surgeries, because frequently the intubation process will adversely affect the temporomandibular joint. This is this young man's cephalometric x-ray. Notice the good drape of his soft tissues of his profile. The lower lip is not horizontal, it is vertical. The upper lip drops vertically too. He also has an excellent airway going for himself, which is good. Many of these patients will have a very narrow airway. This is another view of this patient's airway. Look how excellent and wide this is. Also note he's got compression of his suboccipital tissues. You're supposed to have a 14 millimeter space between the base of the skull and the top of C1. And C1 is supposed to be at a 45-degree angle, like this. And as you can see, it is horizontal. This is a young 23-year-old male with all kinds of facial and neck tics. He's in a very unusual case. Instead of these tics beginning at the age of 6.5 or 7 like most of them do, these began just recently at the age of 22. So he's had them for the past year. He's got 4 different types of diagnoses. Tell them what you have.
They have diagnosed me with 4 different types of dystonia, cervical dystonia, myoclonus dystonia, generalized dystonia, and dystonic tremors, rapid onset.
Okay. And they started with his left leg a year ago. We gave him a bunch of tongue blades to play with last night, and he returns and says that he was able to go to sleep after about an hour instead of the usual 3 or 4 hours it takes him to get to sleep last night, with 8 tongue blades in his mouth. And he likes a vertical dimension of between 8 and 11 tongue blades. And so we're having the appliance made at a laboratory today and overnight, and we'll deliver it tomorrow morning and show you. It will be at least 8 tongue blades high and as high up as 11. And that'll be our starting point. This young man returns the next day and told me that approximately 9 tongue blades diminished his head shaking somewhat and allowed him to fall asleep in 1 hour instead of the usual 3 or 4 hours it took him to go to sleep every night. And this translates into about an opening of 16 millimeters interincisally. And so what we did today was make him his lower appliance, add the acrylic onto it, and have him close down. And you can see how this is approximately slightly less than that. I'll tell you what, take that out, I'm going to make it taller.
Last night, whenever I laid down, I fell asleep within probably 5 minutes of laying down, whereas before it would take 3 to 4, maybe even 5 hours to go to sleep. I would stay up till 4 or 5 o'clock in the morning before I was able to fall asleep. But with this new mouthpiece, I was able to fall asleep within probably 5 minutes with no sleep aids, as the doctors were trying to prescribe me before I came to see Dr. Stack. And now I have no problem going to sleep, and I don't have to take the sleep meds that they were trying to get me to take before.
This young man returns in less than 24 hours wearing the appliance. I want to show you how thick we've made it. He is occluding on the appliance now. It is 15 millimeters tall. Don't be afraid to go into an open bite situation by making a tall appliance like this. Now, this young man is going to tell you what he's experienced over the past 24 hours or less.
I got my mouthpiece from Dr. Stack yesterday afternoon. Before seeing Dr. Stack, I was not able to walk up a flight of stairs without having to either take a break or climb on my hands and knees the rest of the way up. And yesterday I was able to get out of the car, and I probably walked about 3 miles seeing all of the national sites in Washington, D.C. And I even walked up the Lincoln Memorial with hardly any problem. I had to just stop one time to get a break, and before I would have only made it maybe 3 or 4 steps, and that would have been it. It feels almost like my life's been given back to me. I can't thank Dr. Stack enough already for the changes that I felt, and I know it's just going to get better as time goes on.
Okay, you can become a rich man and remember me in your will.
Yes, sir.
Just teasing. Okay. We're going to let this young boy go. He's 23 years old. He's married. Do you have any kids?
No kids.
No kids. Okay, he's going to go back to his young wife now. And we're going to see him in 6 weeks or so for the first checkup. This patient returned 6 weeks later for his first checkup. He told me he had 5 very, very good weeks in which he was approximately 90% better. And then his tics started to return in the last week. I rebuilt his appliance up, the 1.5 or 2 millimeters it was worn down, and sent him back home. He told me for the first time that he was taking 23 medications per day, and that over the 6 weeks he had reduced it down to 6, only taking 6 pills per day now, and he considers that a massive improvement. I'll consider it a great improvement when he's taking no pills per day. This is a 27 or 28-year-old young man who presents with 20 tics: eye blinking, eye rolling, head jerks, shoulder shrugs, facial grimaces, mouth opening, throat clearing, grunting, yelling, and screaming, barking, coughing, squeaking, pitch or volume changes in his voice, echo phenomena, which means he repeats what other people say, arm extending, touching objects, finger smelling, jumping or skipping, thrusting of groin or torso. The clinical information we received on him was that he was diagnosed with Tourette's syndrome at 9 years of age. He was put on multiple medications. He has blurred vision. He states, "I feel like I am going to pass out." This is a feeling which is with him constantly. He has subjective hearing loss, bilateral finger numbness, and his TMJ MRI was negative. TMJ information is that he had bilateral clicking upon protrusion of the jaw. He had no clicking upon opening the jaw. He had right frontal, temporal, and occipital headaches, increasing in severity. He has left retroorbital pain, right ear pain or right otalgia, bilateral tinnitus, bilateral face pain, bilateral preauricular pain, and bilateral lower jaw pain. He has difficulty chewing food, a constant sore throat, feeling of a foreign object in his throat, bilateral suboccipital pain, bilateral neck pain, bilateral stiff necks, cervical crepitus upon movement of the head, and right shoulder pain. This is this patient's cephalometric x-ray, and it is an example of a patient who does not have a very good airway. Look how narrow this is. Look how overgrown or enlarged is his soft palate that blocks this airway almost completely. This is this patient's frontal head x-ray. Even though C1 and C2 seem to be centered and aligned in the midline of the patient's head, notice that C1, which is this whole bone here, is rotated because this is the spinous process of C1, this pointed structure, and is supposed to be aligned with the odontoid process of C2. The midline of the teeth, the odontoid process, and the spinous process should all be in the same line in the midline of the patient's head. This is a young 28-year-old man that presents with Tourette's syndrome. We have given him the tongue blades to find out at what height, what vertical dimension his symptoms decrease. And in the last 2 days or so, he has determined that 8 tongue blades are what stops everything. So put those in. Here he is with 8 tongue blades in, and this is what gives him total relief. In measuring, come in on this. 8 tongue blades equals 15 millimeters inner incisal opening. Okay, this will be our starting point. Okay. We have just increased the height of his appliance about 1 millimeter, 1.5 millimeters per on both the left and the right sides. And he states that his urges have decreased from 50% to 70 to 80% less than they usually are. We'll dismiss him for the night with this degree of treatment and reevaluate him tomorrow morning in about 17 or 18 hours before he leaves home for Kentucky. What's it done for your urges?
Well, the urge is still there, but it's, not like it was.
How much less? Like 50%, 80%?
Oh, probably 50%.
Okay.
I didn't know if it was not yet high enough or what.
Well, usually I make it higher tomorrow.
Yeah.
I might do it right now, in fact. Okay, spread your teeth here. Okay, zoom in on that. Okay, let me get a ruler and Okay, you can see this appliance results in a 8 to 9 millimeter interincisal opening, which he says his urges to tick are about 50% gone. So we're going to increase it a little bit more today to see if we can get a better decrease in his urges to tickle.
It's made a big difference, and appreciate Dr. Stack and what he's done. It's a change in a life.
Yeah. This gentleman returns after 17 or 18 hours of wearing his appliance. It was delivered yesterday afternoon. He says his tics and his urges are down approximately 75%, and that wasn't good enough for us, so we increased the vertical of it approximately 1.5 millimeters on each side, and we have rebalanced it, and you can see the difference it's made. Say something to the viewing audience.
It's like I said, I had it in, and the tics have went from 75% probably to 90% now, and no urge so far to do anything. It's a lot more comfortable than I thought it would be. It's not very invasive, but takes some getting used to. But it's definitely an improvement.
Okay. That's a 90% reduction in his Tourette's tics in 17 hours. No one else is capable of doing that. How many years have you been trying to get treated?
Since I was about 8 years old. I'm 28 now, so 20 years.
20 years of treatment. This gentleman has had his lower appliance exactly 1 month. Tell him what you've been experiencing the 1 month you've been wearing it.
Just getting used to it. Wore it down pretty good, but even at its worst, the tics have been 50% better, 60% better than what they were before I ever had it done. But it's not a problem to eat with it anymore, not a problem to talk with it. It's like I say, at its worst, it's still an improvement, 50%, 60% improvement.
Your family members and friends and acquaintances, what's their impression been?
They're just speechless. They can't believe it. It's just anybody that knows me knows that it's changed completely. Like I say, when I got back and it was built up right, nobody could just hardly believe it because it all just disappeared.
Okay. Today we have resurfaced his appliance and built it back up the amount that he ground it down plus a little more, and we're going to fit it to him right now. I tightened it up for you too, huh? Bite. Okay. Chop chop. Okay. Does one side feel higher than the other?
Yeah.
Which one?
Side,
okay.
right here.
Okay, take it out.
I can feel it more on my front teeth there than.
Gotcha. Okay. How's that feeling now?
That's better.
Better, okay. Does it decrease your urges?
Yes.
Yeah, okay. Okay, I'm going to give you a little more room for your tongue here and now. This is a Tourette's patient with 41 different tics. He has eye squinting, head jerks, tossing of hair off of his face, facial grimaces, mouth opening, nose twitching, shoulder shrugs, arm extending, eye rolling, bilateral, blinking, sniffing, grunting, yelling, screaming, throat clearing, coughing, and squeaking. He touches objects, touches people, smells his fingers, smells objects. He has jumping, skipping, and hopping tics, poking or jabbing, punching, kicking, flapping arms, twisting and twirling around. He tenses muscle groups uncontrollably, thrusting movements of the groin or torso, breathing tics, walking on toes, unusual changes in voice or pitch of voice. He makes animal-like sounds, stuttering, obscenities, socially taboo phrases. His MRI report stated that there was no TMJ disc displacement identified. There were no bone abnormalities. He had bilateral limitation in the TMJ range of motion. The clinical information that he provided was no previous orthodontic treatment, diagnosed with Tourette's at 5 years of age. I noticed his mandibular frenum, or center of his mandible, was 4 millimeters to the right of the maxillary frenum. Bilateral hearing loss. He had left retroorbital pain, vertigo and lightheadedness, loss of equilibrium, bilateral tinnitus, bilateral face pain, right TMJ clicking upon mouth opening, right TMJ clicking upon mandibular protrusion, which leads you to wonder why the MRI did not pick that up. He had left TMJ crepitus upon mouth opening and protrusion. He also had bilateral frontal and occipital headaches. Additional symptoms were that it was painful to chew food, difficulty swallowing, bilateral suboccipital pain, painful to turn his head either left or right, bilateral neck pain, stiff necks in the morning, cervical crepitus upon head movement, and bilateral shoulder pain. Okay. This is a 29-year-old patient that presents with 40 different tics. We are just starting him today. We have taken impressions for a mouthpiece, which we will deliver next week. We have just received his MRI report, which is totally negative for internal derangement. Okay, we're just going to let the camera run for a few minutes while we show some of these tics that this young man is suffering from. We've given him some tongue blades, and we're very hopeful because 3 to 4 tongue blades greatly diminish his tics. And that will be the height at which we begin construction of his intraoral orthotic. We're going to have it made over the weekend. This is the last day of the week that we're going to work. We're going to have it made and presented to him next week. Okay, here we have loaded up the occlusal surface of the appliance with soft acrylic, and we are going to take the sticks out of his mouth open and replace it with a soft acrylic. And just close on down. See, touch lightly. Okay. Open. We are removing this from the mouth. This is what it looks like. Notice how motionless he is when his mouth is wide open. And we're going to flatten it down to where these 4 impressions or imprints are, where these 4 imprints are on each side. What we are going to do is level off the occlusal or biting surfaces on both the right and left sides of this appliance. And we do it by using this lathe with its 3-inch wheel. And we hold the appliance against the side of the wheel like this until the center row of depressions of the lingual cusps of the maxillary teeth are almost gone. So we keep putting it against the side of the wheel until they just about fade away. Then we narrow its occlusal surface, leaving about 3 millimeters of acrylic to the inside of that line, and about 3 millimeters of acrylic to the outside of that line, that is to the outside of that center line. Like so. Then we get rid of any excess acrylic. We bevel the back about 45 degrees where the acrylic fits over the second molar. And we do the same on the opposite side. First we flatten the occlusal surface. So we just have this center line of representing the maxillary teeth, lingual touch. We remove all the excess acrylic, except for about 3 millimeters of it. Then we go to the outside of the appliance. We level the back in the second molar area, 45 degrees. Okay, tell the viewing audience how you feel. You've had this in your mouth now 5 minutes by the clock.
Well, as I guess planned, the urges are dissipated. They're not as severe. Still getting an occasional urge to twitch, and those aren't even as prolonged as previous. So far, I definitely think it's working. As I said before, it's definitely doing what it's supposed to. Control the urges. Yeah, like about 60% less urges, at least. I mean, for me, it's hardly noticeable anymore.
Okay, this is the end of the delivery appointment. After 5 minutes, his urges are down 60%, which is typical. That's what we've noticed in most of these young adult males. And once the urges go away, then the actual motor movements go away shortly thereafter. So we're highly encouraged. I want you to pay particular attention to how you sleep tonight and the next night. I got it open. You notice I got these ledges here for your tongue. You keep your tip of your tongue up here like that, and that'll make you sleep better at night because it'll open up your throat. You'll breathe better. You get more oxygen.
We delivered this gentleman's lower appliance 1 week ago, and he returned today to receive his upper appliance. We have put in his upper appliance a few minutes ago. We'll dismiss him now and see him in 3 weeks' time to see how he's coming along with both appliances in. We have adjusted the upper appliance that we delivered today to the lower appliance and rebalanced everything out.
This young man has now had his appliances for a total of 3 weeks, and you can see the difference.
Over the last 3 weeks, I've noticed a great deal of a benefit from these devices. At times, up to 80% difference in the reduction of the ticking from Tourette's. I mean, as you've probably seen in the last videos, you know, my head, my arms, legs are going crazy. At this point now, it's not the case. Occasionally I do have, you know, tics, outbursts, but they're mainly limited to my neck. My arms and legs really don't twitch at all anymore. So I'm very grateful for this treatment. It's definitely done a lot for me.
Is this young boy's mother who's going to tell you the improvement in the last 3 weeks?
We have been so pleased and so blessed that Brian is seeing this kind of improvement. He can sit through a meal, he can read some now. He does not suffer from the headaches and shoulder aches that he used to. He can drive. I don't worry so much about him driving anymore, that he's going to have outbursts and run off the side of the road or something like that. I'm just very, very grateful for everything that Dr. Stack has been able to do for Brian, and I'm happy for Brian that his life is, since he was 5 years old and now he's 27, that things are looking very, very positive for him.
This adult Tourette's patient reports that his tics began at 6 years of age and that he has obsessive compulsive disorder, vocal and physical tics. His MRI says the left anterior disc displacement with reduction. Left condyle has a round